Hello, my name is Professor Andrew Davey. I'm the Director International of the Health Group at Griffith University. Today I'm coming to you from the Gold Coast. So here on the Gold Coast, we're very lucky in that we enjoy amazing climates, fantastic beaches, as you can see, and a really, really nice lifestyle. So hopefully I will get to see you all on the Gold Coast soon. This is the campus where I work. So my office is here in the Griffith Health Building, part of a major campus that covers all of the university disciplines, but right across the road from two major hospitals and an innovation park that specialises in health and medical research. So I'm very, very lucky to live and work on the Gold Coast, particularly on our Gold Coast campus. The Gold Coast campus is actually one of 5 campuses that Griffith University has. 3 in Brisbane, 1 Logan, and the Gold Coast is the larger of the campuses. So all of those campuses have a really good vibe, but all offer a slightly different experience. I want to spend the next 10 or 15 minutes speaking to you about health and health careers, because I think it's really important that you have information about your future career as you are in the process of making decisions about potential degree programs that will set you on the course for the rest of your life. I often speak to students about why they might be interested in health. There's lots of reasons people may give. Some students are really keen on chemistry and biology and sciences. Others may be more motivated by caring for people, wanting to help people. And a few like the idea of maybe getting into management or health policy or health economics, those sorts of areas. Whatever your interest, there is a health program that will suit you. And what I'll hope to do is show you as we go through some of the ways in which different health programs may align with your own particular strengths and interests. But one of the great reasons to do health is career outcomes. This is a set of data that comes from a survey the Australian government puts out every year called the Graduate Outcomes Survey. One of the many questions on that survey is, are you in employment? What I've done for undergraduate or postgraduate studies, listed the top 5 study areas in terms of people getting employment within 4 months of graduation. If we look at undergraduates, we see pharmacy, rehabilitation, which is things like physiotherapy, occupational therapy, clinical exercise physiology, speech pathology, those sorts of areas, dentistry, teaching, education, and medicine. 4 out of 5 of those fields of education are health related. If we look at postgraduates, we've got medicine, nursing, vet science, rehab, and pharmacy. So again, health dominating the top areas in terms of getting employment. This other survey, which I've referenced here, I won't speak to too much, but what that demonstrates is that not only do health graduates get the best employment rates quickly after graduation, but they maintain that over the medium term. So really good job prospects for health graduates. That's employability, that ability to get work quickly is likely to continue into the near future. This is projected employment growth by industry sector over the next 4 to 5 years, and ranked by the area that has the biggest jobs growth. So the length of the bar represents industries where we expect the largest employment gains. You will see that number 1 is healthcare and social assistance. So already health graduates have the best employment outcomes. In the future, certainly in the short to medium term, that will only accelerate. Those of you interested in maybe biomedicine, pharmacology, health sciences, maybe exercise science, those sorts of areas, again, working in that professional, scientific, technical services area, you should expect really good employment growth as well. Where's that employment growth happening? well, all around the world, actually, but within the Australian context, the big areas of employment growth, as you would expect, Melbourne, Sydney, Brisbane to some extent, but right up there in third position is the Gold Coast. So it's the only one of these regions that are experiencing very high jobs growth that has the benefit of the 3-year post-study work rights. So if you study in Melbourne or Sydney or Brisbane, you'll get 2-year post-study work rights. Study on the Gold Coast, you get 3 years. So you've got really good industry growth combined with that opportunity to gain employment and gain skills and experience before returning to your home country. That industry growth is being led by healthcare and social assistance on the Gold Coast. So, really, really good place to study health and health sciences. So that really is looking at jobs growth in the short to medium term. What about the long term? 10, 20, 30 years time, throughout the duration of your career. What we know is we have an aging population in the world. So in the 1950s, the world population was much smaller than today, but certainly the people over 60 and over 80, there weren't many people in that age bracket around. Looking into the future, 2030s, 2050s, more and more people are going to fit into that category of 60 plus, 80 plus and beyond. What does that mean for you as somebody who may be entering a career in health? There's a number of implications. One, as we get older, we tend to develop chronic diseases, multiple morbidities. So people in their 60s and 70s, maybe have some cardiovascular disease, probably have some arthritis, some dementia. They may have had some cancers and recovering from that. Kidney function will be declining, and so on and so forth. So as their healthcare needs become more complicated, the need to access healthcare from many disciplines becomes greater. So rather than somebody just relying only on their medical doctor with a 15, 20-minute consultation, what they need to access is a whole team of people. So obviously the doctor, maybe the nurse, the pharmacist, the physiotherapist, social worker, maybe looking at nutrition and dietetics, and so on. So what that means for you is whichever part of the healthcare sector you decide to enter, you'll have a really, really valuable role to play in helping address that aging population. The other thing that is tending to happen as well is more and more new technologies. So we're advancing very quickly, not just in terms of our understanding of disease, but in areas like IT, electronics, engineering, robotics, all of those coming together and creating a lot of innovation that you will have the opportunity to use throughout your career. So it's a really exciting time to be entering healthcare. What I thought I would do just for a few moments is use the current pandemic to highlight some of those points about the need for different disciplines to come together to tackle a major health challenge. So I've used COVID-19 as an example on this slide. Could be any health challenge, the aging population, cancer, infections, whatever it may be. But I think this is a useful example to highlight different areas where you might go within your career to make a really good contribution to society. So we have graduates from our biomedical science programs, maybe developing the vaccines, our medical laboratory scientists, doing the diagnostic testing, our pharmacologists searching for a cure. A whole range of professions who are dealing directly with patients, so doctors, nurses, pharmacists, involved in direct patient care. Our paramedicine graduates, transporting people to hospital, maybe responding to emergency situations. And our allied health team, making sure people are in good health, so they're not as susceptible to the effects of the disease, helping maintain their health if they're in hospital and needing some support, nutritional support, and ensuring that they recover quickly if they do have adverse effects. And then we move on to psychology and counselling, and it may not be intuitive that people with a degree in counselling or psychology have anything to do with the virus. But when we look around what's happening, we need people to demonstrate certain behaviours. We need them to stop having behaviours that don't help. In Australia, people go out and buy lots of toilet rolls. That doesn't help us deal with the disease. What we need is people hand washing, social distancing, going into isolation when they need to do so. But the other part of that is there is a mental health impact of this disease. So, people who are in isolation, suffering from social isolation, lack of interaction, maybe people anxious about the effects of the disease, worried about loved ones getting sick, or even about losing their own jobs, because there is an economic impact as well. And if people are losing their jobs, then we need our social workers and human services graduates helping them. Graduates from public health, ensuring that interventions are put in place, whether that's at the global level, the national, state, down to hospitals, schools, making sure there's interventions in place there that reduce the impact of this disease. And health services management graduates, drawing on resources, human resources, equipment, financial, making sure that the health system, whether hospital or nursing home or major health centre, is able to cope with a changing environment. This slide highlights, I guess, the importance of health professionals during a crisis, but it also indicates the sorts of occupations where there's really strong job security. So the Australian government have listed the top 20 resilient occupations. So these are occupations where you expected strong jobs growth before COVID. They weren't negatively impacted by COVID. And as the pandemic subsides, we're continuing to see strong job security and jobs growth. I won't go through them due to lack of time, but what I've done is highlighted all the health professions in red. And what you can see is that 14 out of those 20 resilient occupations are health professions. So good job security if you study a health degree. The other great thing about a health degree is it can lead you into many areas. Whether you studied pharmacy or social work or medicine or nursing, allied health, whatever it may be, you can go into many areas. Research, working for the government sectors, out in clinical trials, working in the community, aged care centres, working in industry, particularly for biomedical devices, obviously in hospitals, but also in schools, military, working for yourself in private practice if you've got a bit of an entrepreneurship bent about you, sales, marketing in the industry, academia, and so on. So lots of areas that you can go into in your career. So you're going to have a very varied career. At the health group at Griffith, we've got over 24 different disciplines. And that is covered by 100 programs. So you've got lots and lots of choices about what area you can study and what area you can move into. We do offer a lot of advanced teaching, so work integrated learning, clinical placements are important, simulations, physical simulations, but also virtual to really hone your skills, and a lot of interprofessional learning to equip you to go into the healthcare setting and work in a team. I'll encourage you to have a think about all the different areas. So whether you're looking at social work or nursing or public health, with the pharmacy, medical laboratory science, biomed, nutrition, OT, physio, medicine or dentistry, there's certainly degrees that would suit you. And moving on to postgraduate, lots of areas, medicine, social work, global public health, where you can specialize and advance your career. So just to summarize, whatever your interest, there's probably a health degree that suits you. We know you're going to get really good job outcomes. High demand right now for health professionals and medical scientists. That's only going to grow with time. You've got the opportunity to go on a very varied career. And if you study with us at Griffith, we're one of the largest, most comprehensive health faculties in Australia. We offer advanced training in many areas, and you get to live, work and study with us in South East Queensland, particularly on the Gold Coast, where you get that additional year post-study work rights, as well as the really great study environment. So thank you for your attention, and certainly please contact us if you require more information.